Flexicare's high-flow nasal cannula delivers high-flow oxygen therapy using warmed and humidified gas with oxygen concentrations between 24 and 60%. Flow rates are between 8 and 20 litres per minute for premature babies through to pediatric patients, and 40 litres per minute for adults, providing versatility to meet the individual patient's needs should their condition change. For patients with mild to moderate respiratory distress syndrome, high-flow oxygen therapy improves blood oxygenation and reduces work of breathing without the need for non-invasive ventilation or intubation in selected patient populations. The Flexicare high-flow nasal cannula comes in a wide range of sizes to accommodate all patients. The unique sizing guide means the most suitable size for the patient can be selected without opening the sterile packaging. To use, simply hold the guide up to the nostrils and identify the optimal size for the patient, assessing both prong diameter and septal width. Please note that the cannula prong should not completely seal the nares. If this occurs, select a smaller cannula size. Position the pressure relief valve onto the humidification chamber port and connect the tubing from the oxygen blender. Connect the angled connector of the inspiratory limb to the other port of the humidification chamber. Set up the breathing circuit, humidification chamber, and respiratory humidifier following the manufacturer's instructions for use. Insert the chamber outlet temperature probe sensor into the sensor port of the inspiratory limb angled connector. Insert the airway temperature probe sensor into the sensor port. Push sensors firmly into place and ensure they are fully seated. Connect the high-flow nasal cannula to the breathing circuit limb using the adapter included in the pack. Set the oxygen concentration and adjust the flow rate to the recommended value stated on the product labeling. Open the pinch clamp and allow the sterile water to flow into the humidification chamber. Once the chamber has filled with water, turn on the heater humidifier following the equipment manufacturer's instructions for use. Ensure that there is a gas flow through the nasal prongs and there are no blockages in the system. Allow the gas to become warm and humidified before fitting the high-flow nasal cannula to the patient. Position the nasal prongs in the patient's nostrils and pass the tubing over the ears. Move the sliding collar to secure the nasal cannula. This may be behind the head for small babies or under the chin for older and adult patients. Regularly check the system to ensure the tubing is not twisted or kinked and that gas is flowing freely. The clinical benefits of high-flow oxygen therapy include the delivery of accurate high fraction of inspired oxygen and optimizes the patient's mucociliary function.